Hello, my name is Kurniati Atmaja with student number 216, and I will explain about the introduction. So, rubella is an infection by a virus, which is usually a mild disease in most cases. And the infection is characterized by maculopapular rash, low-grade fever, lymphadenopathy, sore throat, red eyes, malaise, headache, and anorexia in children. The MR vaccination program has been introduced in Indonesia by 2017, and the campaigns were targeted to all children 9 months to 15 years old without reference to their vaccination status or history of measles and rubella infection. And this MR vaccination succeeded to decline the rate of rubella infection by 85% in 6 provinces of Java. However, the study was concerned of the impact of the vaccination program have not much been done in Indonesia. Because of this lack study, this review provides an effective surveillance system in promotion to vaccination program to prevent rubella infection in the world.
Hello everyone, my name is Candra with my last name DJs 152, and now we'll discuss about the determinants of congenital rubella syndrome or CRS after measles rubella vaccination. So to begin with, CRS is a condition of various congenital abnormalities that occur in infants due to rubella virus infection that happens during the first 12 weeks of pregnancy. Congenital abnormalities caused by CRS may cause serious consequences in the form of permanent disability, medical and financial burden that may cause years. And CRS cases still occur in countries with low or no implementation of rubella vaccination at all. Indonesia is one of the countries that still struggles with CRS cases every year. In 2021, Indonesia became the country that reported the highest cases of CRS in the whole Southeast Asia region, up to 57%. So the first epidemiological aspect of CRS is the agent itself, which is rubella virus. It is an RNA-stranded virus of the toga virus family. It acts as an antigenic type that binds into specific antibody or T cell receptor, which triggers the host immune response. Transmission of rubella virus occurs through respiratory and throat secretion of subclinical cases, and in CNRs, transmission specifically occurs vertically through the birthing process between the mother and the child. So the next factor is the host factor in CRS, which is children aged 3 until 10 years old in developing countries, including Indonesia. Maternal immunity gained through breast milk only lasts up to 6 months in children. So this brings up a strong necessity for children aged between 9 months to less than 15 years to get an MR vaccination shot to eradicate rubella or significantly reduce the burden of CRS through successful vaccination programs. Lastly, the environmental factors that play a role in CRS, including the change in season pattern, where CRS usually occurs in winter and spring season. The next one is influenced by low maternal knowledge, the lack of family support, maternal employment status, and misguided perception towards vaccination itself.
Hello everyone, my name is Juven Luvianto, the student ID number is 091. I will continue about the rubella natural history of disease. The first step is exposure of rubella virus to susceptible hosts. The risk factor for rubella include unvaccinated individual, endemic area, immunodeficiency, and exposure to household member with rubella. The incubation period is about 2 to 3 weeks, usually start by predominant symptoms such as low-grade fever, sore throat, and others. And then the pink maculopapular rash start to begin on the face. The rubella is infectious 8 days before and after the onset of the rash. The patient may fully recover, have complication, or even death. The disease usually resolved by supportive treatment in 3 days or after the humoral immune system develop. If pregnant woman is infected during the first trimester, the fetus is in risk for congenital rubella syndrome up to 85 to 90%.
Hello, my name is Ketot Adelia Febrianti Puspadewi with the last 3 digit of my student ID number is 041. So I would like to continue the presentation with the relationship of congenital rubella syndrome to occupational disease. Occupational disease is any illness that has a specific cause or a strong association with work, generally consisting of one causative agent, and there must be a causal relationship between the disease process and also the workplace hazard. Workers are at risk of occupational disease, especially healthcare workers who are exposed to the wide range of the health hazard, including infectious disease, some of which, such as rubella, compared to the general population. Rubella infection, especially during the first trimester in pregnant women, may cause stillbirth, miscarriage, and also congenital abnormalities known as congenital rubella syndrome. There are previous studies that reports of rubella outbreaks that also affected in healthcare workers for some countries, for example, United States and also Japan. Therefore, rubella infection is considered as occupational disease when it occurs to healthcare workers, especially in women of childbearing age, due to their occupational exposure that may lead to congenital rubella syndrome.
Greetings, I'm Dhiyo and my student identification number is 133. The study implements absolute number and relative numbers, as can be seen in these examples. For absolute number, the study involved 229 infants who were suspected of CRS from July 2015 to July 2020. For relative numbers, The example is, we found that 47 of them, or 20.52%, were classified as laboratory confirmed CRS case. 69% of the suspected cases, or 159 of 229, were classified as discarded. 9%, or 21 out of 229, were clinically compatible, and none of the infants was congenital rubella infection. The study used a longitudinal approach to measure the impact of measles rubella vaccination of congenital rubella syndrome. To demonstrate this, data was illustrated using a 9-month incidence rate, as can be seen in this example sentence. The CRS incidence was 0.39 per 1,000 live births in pre-campaign and 0.08 in post-campaign. Other than the crude rate mentioned above, the study also mentioned specific rates to explain incidence of certain clinical manifestation of congenital rubella as shown in this example. The most common group, a clinical sign among confirmed CRS cases, was congenital heart disease, N equals 43 out of 47, or 91.4%, followed by congenital cataract, N equals 32 out of 47, or 68.1%, and hearing impairment, N equals 26 out of 46, or 55.3%. The study also implemented adjusted rate in the form of incidence rate ratio, as can be seen in this table.
My name is Karina, with the last 2 digit of student number 003, and I will explain about the study design used for this research. There are 2 main study designs, analytical and descriptive designs. Descriptive designs are divided into case report, case series, and cross-sectional studies. Meanwhile, analytical studies are divided into experimental and observational studies. Observational studies are also divided into cross-sectional studies, case control studies, and cohort studies. This journal specifically used cohort studies, which means the study refers to the kind of forward direction studies where the researchers evaluate the outcome presented on the samples after a period of time. To be precise, the study uses prospective cohort studies, which means the outcome happened while the researchers tracked samples and collected the data after a period of time. The study matches with the initial objective of the research, which is to discover the impact of the national vaccination campaign by conducting surveillance of CRS cases and comparing the incidence of new CRS cases before and after the measles rubella vaccination campaign after a period of time. By comparing the data, researchers found out there is a significant amount of declining numbers of CRS cases before and after the vaccination campaign, thus providing data for promotion on the vaccination program as one of the efforts to eliminate rubella infections in the world.
So my name is Putri with the last digit number 002. I will continue the presentations and answer the questions number 6 about data analysis and also presentations. So in these journals, data that were used are univariate data and also bivariate data, which univariate data provides a descriptions of its characteristics. Meanwhile, bivariate data describes the relationships or correlations of 2 variables concurrently. A descriptive analysis was carried out to characterize the demographic and also clinical characteristics of the cases before and after the MR vaccination campaign. The total infants who were suspected of CRS of the study were calculated from July 2015 to July 2020. The population value is calculated as a percentage based on 3 classified cases, and data analysis on socio-demographic and clinical characteristics was carried out on one of the classified cases populations in which laboratory confirmed CRS cases. So there are tables and also figures that use to compare, show, and summarize numerical data for a variety of criteria in this journal. The first table and also first figure show the incident rates of CRS cases in Java before and after the campaign around August to September since 2015 to 2020. From the table and the figures itself, it found out that after 1 year of introducing the MR vaccine campaign, there is significantly decrease with p-value 0.00 of new confirmed cases. And the second table displays the socio-demographic data and clinical characteristics of the respondents who took part in physical examinations. From the table, it shows that the cases come from children aged 1 to 5 months with similar numbers between each gender. And the average maternal age is 30 years. And in terms of pregnancies, the mother is primiparous. And the average weight of the infants of around 2,300 grams. The last table shows the clinical characteristics among the patients. The clinical characteristics are divided into 2 groups. For the first is group A with congenital heart disease, cataracts, hearing loss, pigmentary retinopathy, and also congenital glaucoma. And the last group or group B consists of microcephaly, developmental delay, jaundice in the first 24 hours after birth, purpura, meningoencephalitis, splenomegaly, and also radiolucent bone disease.
Hello, my name is Kirana Candra with last 2 digit of my student, the number is 168, and I'm going to tell you about the bias of the study. So the bias of the study is called as recall bias. Any inaccuracy resulting from the limitation of someone to remember information related to the topic with what actually happened is called as recall bias. The samples for this study were collected months after the rubella infections of the modern patients who only experience a single rubella infection symptom, particularly those with mild symptoms, are unlikely to seek medical attention. This is also a result of pregnancy related unspecified clinical signs of the rubella infections and low knowledge of the disease from the mother itself.
Hello, my name is Kylie Wingel with student ID number 200251189. I will continue the presentation about potential for outbreak. One of the efforts that can be made to detect potential outbreak of congenital rubella syndrome or CRS is by case surveillance after the national vaccination campaign. Surveillance is the systematic and ongoing collection, analysis, and interpretation of health data, which is important for the planning, implementation, and evaluation of public health practices, which is closely integrated with the timely dissemination of data to those who need it. States effort that to prevent potential CRS outbreak in endemic countries are effective vaccination promotion program, increasing vaccination coverage among vulnerable population, implementing MR vaccination as routine preconception care for mother before pregnancy, and implementing effective CRS surveillance system. That's all from me. The next will be explained by my friends.
Hello, my name is Lordia Lin. My last three-digit number is 131. I'm going to continue our presentation about the possible surveillance system. Some surveillance setups that are implemented in this study are data collection of primary socio-demographics, data on maternal infection symptoms, and lastly, physical examination on infants. Other surveillance setups that are implemented are CRS surveillance system through the clinical signs of patient, where a full clinical examination is performed on a suspected patient to identify any additional possible damaged organs if they display at least one symptoms listed by World Health Organization as part of the CRS case criteria. And next are a few potential surveillance setups that we can implement. The first one is lab-based surveillance. Labs can take part in surveillance by routinely checking blood samples from pregnant women for antibodies to the rubella virus. Positive outcomes may prompt more research into possible CRS instances. Second one is birth defects registries. Some areas keep birth defect registries that gather information on newborns born with congenital malformations such as CRS. This database might be used by CRS as passive surveillance mechanism. The third one is communication and education campaigns. Public health agencies can use education and communication campaigns to implement monitoring while informing the populace, particularly pregnant women, about the dangers of rubella and the value of vaccination.
Hello, my name is Herry, and my last three digits of the ID is 081. And today I'm going to present about the proper screening method. So based on this journal, 229 patients with a suspected case of congenital rubella syndrome are recruited from the child health departments, ophthalmology departments, and otolaryngology departments. They are patients with a suspected case definition of congenital rubella syndrome. The suspected patients will undergo several methods of screening, such as interviews, physical examinations, and medical records. Then, the researchers implemented a surveillance system based on the clinical manifestation of the patient. If the patient has one symptom of CRS based on WHO's definition, they will undergo a complete clinical examination to determine other affected organs. The patient who had incomplete clinical data sets and whose blood was not collected were excluded from tests. Some of the issues of blood collection are technical problems related to the time of collection. The patient had died before the samples were collected, and the patient's residence was too far away from the collection site.
Hello everyone, my name is Kylie with the last three-digit number is 114, and today I'm going to explain about the relevance of this journal to disease prevention and control efforts in the community. So the first one, it provides insights into the impact of measles rubella vaccination. Then the second, it helps in assessing how well the vaccine is reaching the target population and reducing the incidence of congenital rubella syndrome and measles. And also, effective surveillance helps in early detection of cases, allowing for prompt response and countermeasures. And then the lesson learned and successful strategies identified in this context could contribute to global efforts to control and eliminate these diseases. So in conclusion, this journal article likely provides valuable information that can inform and improve disease prevention and control efforts related to rubella and measles in the community.
Hello again, my name is Kurniati Atmaja with student number 216. This study used a longitudinal approach with implementation of adjusted rate from the absolute and the relative data. The study design is a prospective cohort study to evaluate the incidence rate of CRS in period point of time to discover the impact of national vaccination campaign to the CRS cases. The relation of the data characteristic and the outcome are analyzed descriptively, and the tables are used to compare and summarize numerical data for the variety of criteria. According to the journal, the outbreak can be prevented by a great surveillance system and effective program. Some example of possible surveillance system that could be implemented includes lab-based surveillance, birth defect registries, and communication and education campaign monitoring. This general surveillance measure is relevant to disease prevention and control in community, allowing the understanding the dynamic of rubella transmission before and after post-vaccination program. Thank you.